Gloves and goggles. Any dangers?
There's no danger.
No dangers. Hi, my name's Alistair. What's your name?
Hi, my name's Jane.
And this is Steph from We're from the Ambulance Service.
Hi, Steph.
So we've got airways, breathing and circulation or as a response. Is there any hemorrhage?
No, no,
No hemorrhage. Okay, so why have you called us here today?
I've got really bad, just my pain. It's really bad. My stomach is really hurting me.
Yeah, and you said your name is Jane, yeah?
Jane, yeah.
Jane. Okay, and how long have you had this? Okay, so are you comfortable there?
Yeah, I'm not gonna lie. I mean, I've sat up and I've sat down, but nothing seems to be helping.
Nothing seems to be working. Okay, we'll just leave you in that position for a little bit then. So sitting back doesn't help you at all?
No.
Not really? Okay. Just stay where it's comfortable for you then. And do you have any concerns at the moment?
I mean, I don't know what's going on. Like, I've never had this type of pain in my stomach before. I'm just scared something might be wrong.
Yeah, no, that's alright. We'll figure this out. So, and do you live alone at the moment?
No, I live with my boyfriend.
Live with your boyfriend?
Yeah.
Okay. And is he here at the moment? Or?
No, he's at work.
He's at work. Okay, that's alright. Okay. Now, so you said the pain was in your abdomen?
Yeah.
Yep. Is it radiating anywhere or?
No, it's just literally my stomach. Yeah.
Yep. Okay. And when did this start?
It started about 2 hours ago. Yeah.
2 hours ago. Okay. And it was in your abdomen. Yeah.
Yeah.
Yep. So is it going around to the back or?
No, I don't know. It's just here. I don't think it's going to my back.
Yeah, fair enough. Now, if we took that pain away from him, is there anything else that's hurting or?
No, it's just my stomach. Yeah.
Okay. And so then on the severity. So if you were to rate this from, so 0 being no pain to 10 being the worst pain you've ever felt, what would this pain be?
It's at least an 8.
At least an 8.
Really bad. Yeah.
Really, okay, yeah. Now, are you allergic to anything?
Peanuts.
Peanuts, okay. And do you have any medications for that?
No, I don't have any.
Okay. And what happens when you have peanuts?
I just get hives.
Hives?
Yeah.
Okay. Okay, so you don't have any medications for that one? Or do you carry an EpiPen around with you? Or?
No.
No?
Not for my peanuts.
No, okay. Is there anything else that you're allergic to or?
No.
No, fantastic. And do you have any past medical history that's relevant to this?
No, I have a bit of asthma.
Okay.
But I can't see how that would be related.
Fair enough. And do you carry a Ventolin for that one?
Yeah, I've got them.
You got Ventolin, okay. Okay, now where did you eat last? So when was your last meal?
It's probably this morning.
This morning?
Yeah.
And what did you have?
I just had a plate of cereal.
Yeah. Okay. And have you been going to the toilet regularly since then? Or?
Yeah, it was this morning as well.
Yep. And it was poos and wees?
Yeah.
Yep. Okay. And what happened leading up to this pain? You said it started a couple of hours ago.
Yeah, I just had coffee and I was replying to some emails and I was just sitting at my desk.
Yep.
And I just started to get this kind of like almost like a cramp.
Yeah. Okay.
And then I just thought I'd ignore it.
Yeah.
And like gradually it's been getting worse. And yeah, I don't know, it just got to the point where I've never had this pain before and I just had to call an ambulance because I don't know what's going on.
Fair enough. Well, what I'd like to do is I'd like to take a few vital signs off you. So is that alright if I take a few things like your blood pressure and whatnot? Okay. So do you mind if you just hold out your arm for me? Is there an arm you prefer to have your pulse or blood pressure taken on? Or?
I don't know, this should be fine.
Have you ever had this thing before? No? Okay. Hopefully you better sit back for me as well, please, if you can.
Yeah, sorry.
so we have a pulse rate of 60 and a respiratory rate of 16.
What does that mean?
Okay, so that's fairly normal. And sorry, how old are you, Jane?
30 years old. 30
years old, okay. Yep, so that's fairly normal. So pulse is, you know, your heart rate's about 1 beat per second, which is pretty healthy for you. And yeah, for an adult, respiratory, taking breaths is about every 16 per minute is pretty normal. So. Okay. Now I'd like to take your blood pressure. Now, have you had your blood pressure taken before?
No.
No? Okay. Okay, I'd like to. So is it alright if I just get you roll up your sleeve for me? Now, if you had a mastectomy or anything?
No.
No? Fantastic. Yeah, is that comfortable there?
Yeah.
Fantastic. Now just get you to lay your arm down. Now, it's going to be a bit of a tight squeeze on your arm. Don't be too concerned about it, okay? Okay, so you're about 115 over 90, which again, very normal for an adult of your age. So just take some for you. Okay. Okay, so I'm just going to check your capillary refill as well. Yep. And your warm, pink and dry. Yep. Do you usually have bit cold hands? Or?
Yeah, usually.
That's usual. Okay. So. So warm, pink and dry, well confused. Okay, so I'm just going to ask you a couple of questions. Just answer the best you can. Now, do you know what day it is today?
It's Friday.
Friday. And do you know where you are?
Yeah, I'm in my house.
You're in your house, fantastic. And what month is it?
We're in May.
And what year?
2015.
Fantastic. I'll just get you to reach up and squeeze my fingers. Fantastic. And just lift your knees up against that. Thank you. So say GCS at 15. Eyes 4.
What does that mean?
So just checking your how alert you are to things around you.
Yeah.
So I'm checking that your eyes are spontaneous to me and that you're verbal, which is good, and your motor skills are fantastic. So 15 for you, top marks. What I'd like to do is I'd like to listen to your chest. So just to get a respiratory status assessment. So your position is normal. Your appearance, you don't seem to be laboured or anything in your breathing. You're not blue, so which is good.
No.
Speech is normal.
Yeah.
I want to listen to your back, so listen to your lungs, just to see if there's any adventitious sounds. So I'll just do it over your shirt if that's alright. Yeah. So I'll get you to cough for me and just take a couple of deep breaths. Now it might be a little bit cold, but just keep taking deep breaths for me. Yep, so that's all normal. So air entry so air's entering from all the way from the top to the bases, from apices to bases. No adventitious sounds, so there's nothing going on there, and left equal drive, which is good. So, which is again normal for someone
Okay,
our
yeah.
age. So, what I'd like to do is I'd like to take a few other vital signs. So I'm going to take a temperature, blood sugar level, and we'll put some dots on you just to make sure your heart's not playing up. So for the ECG, I'm going to put the white one up on the top right on this side, the black one on the other side, and the red one down the bottom here. So, for temperature, go up into the temperature thingy. Now, do you mind having your temperature taken? So I'm just going to stick this one in your ear. Shouldn't be too. Okay, so 37 degrees temperature, which again is very normal. So the blood sugar level, what I'd do is I'd grab your hand, I'd swab it, warn you that there's going to be a sharp prick, and then I'd take prick the skin and take a bit of blood out to check the blood sugar level, which is all normal. And this is going to be SATs, so for oxygen and another pulse check, I'm going to put just a thing on your finger which will check the oxygen level in your blood. And there's pupils, so I check your pupils are reactive to light with a pen light. Check that they're reactive to light and that they equal, so they're constricted both. And I get you to take the glasses off for that one. Then I do a head to toe, so I'll just palpate your abdomen to make sure, to check to see if it favours the side or if there's any abnormal pain there. So, yeah, all good. Now, what I'd like to do for your pain is I'd like to actually give you some methoxyfluorine. Now, I just have to check a few things before I do. Are you on any antibiotics at the moment?
No.
No, okay. And have you seen an ambulance in the last 24 hours? No. And have you had any kidney failure, or are you on any dialysis? No. No, fantastic. Okay, so I'll grab a green whistle if I could, please. Thank you. Okay, so methoxyfluorine 3 mils, expiry 2019. Yep, can you show that one?
219, methoxyfluorine 3 mils.
Thank you very much.
Okay.
Put around the edge. Let's soak in. Now, what I'll get you to do is I'll get you to put this on your wrist, and then hold on to that. Now, what I want you to do is take a few deep breaths through it, and then out through the mouth. So out through the nose. So it might taste a little bit bad for a little bit, but it's going to really help with the pain. So just a few deep breaths, and that one should be all good. And if it's not quite strong enough, if it's not doing anything, there's a hole on it. You can just put your finger over the hole to make it stronger. How's that pain now?
Yeah, it's getting better. Yeah.
So what would you rate it out now?
It's probably a 5 now. Yeah.
Probably a 5? Okay, that's good news. So now you're done? Happy with that?